War crimes, phony science, killer side effects, and the dark truth about whether they even want you to get better. These are the most insane big pharma conspiracies that turned out to be true. Number 14. Mainstream corporate media lies to lay the modern opioid epidemic at the feet of foreign drug cartels. But the truth is, Big Pharma and the American government have colluded to make money off addiction and death for almost a century. And it all started with World War II and a man named Harry J. Anslinger, the true architect of the war on drugs. But his real war was against only the drugs that he and his buddies couldn't profit off. Anslinger hated drugs with such a burning passion that he was made the first commissioner of the Federal Bureau of Narcotics. He stuck around, maintaining his leadership through the presidencies of Herbert Hoover, Franklin D. Roosevelt, Harry S. Truman, Dwight D. Eisenhower, and John F. Kennedy. It was a tenure of 32 years. Clearly, he was a passionate prohibitionist. But there were deeper motivations at play. According to Norman Ohler's book, Tripped: Nazi Germany, the CIA, and the Dawn of the Psychedelic Age, Anslinger closed a major deal in 1939 while World War II was raging, 2 years before America officially became involved. If recent conflicts have taught us anything, it's that war always disrupts supply chains, and that, of course, includes pharmaceuticals. In particular, one of the most valuable and dangerous kinds of pharmaceuticals out there, opiates. Anslinger, who for all his many faults had no shortage of cunning, figured that it was only a matter of time before the war collapsed opium supply chains, so he made a deal with the American pharmaceutical industry to invest heavily in the production and stockpiling of massive quantities of the drugs. It was enough to supply not only the US but all of their allies in World War II. A mix of public and private American funding sent opium production in Iran, Turkey, and India into maximum overdrive, producing veritable mountains of the deadly brown gold. In 1942, the year after the surprise attack on Pearl Harbor and the United States officially entering the war, Anslinger collected his return on investment. Over 300 tons of opium was imported into the U.S., transported in 10 trucks to Fort Knox, and guarded by machine gun-wielding agents of Anslinger's Federal Bureau of Narcotics. From there, it was sent to all the pharmaceutical companies, who then refined it into usable opiate drugs. This foresight turned out to be an extremely profitable one. All of Americans' allies ended up depending on American opiates for their frontline medical needs. U.S. Big Pharma became the Allied world's drug dealer. So how did the Nazis factor into all this? Post-World War II, Anslinger's department was in charge of regulating illegal narcotics in some of the Allied portions of denazified Germany. There, he and other American officials became acquainted with Nazi policy on drug control. They were effective, at least on paper, if you ignore the fact that all these laws were often used as an excuse to lock up Jewish people under false pretenses. Anslinger used a lot of these policies to shape his propositions at the United Nations Narcotics Commission. After all, when your goal is to control the supply, why allow competition? And as you're about to realize with our next conspiracy, nothing much has changed. Number 13. According to the DEA, 2.2 pounds of fentanyl has the potential to kill 500,000 people. It reached a peak of over 73,000 deaths in 2022 alone. Ask any American politician, law enforcement, or media figure where it's coming from, and they'll give you the same answer: smuggled across every border by Mexican and Chinese drug cartels. It's a convenient excuse, especially when you're taking kickbacks from the real culprit. To borrow an old cliche, the call is coming from inside the house, and it's offering you a lap dance. That last part actually wasn't a figure of speech, it really happened. A pharmaceutical executive for the company Insys Therapeutics took a Chicago doctor named Paul Madison to a nightclub and they gave him a lap dance. It was all part of a wider scheme to get him to prescribe more of their incredibly potent fentanyl spray, Subsys, to his patients. And this was part of the over $70,000 exchanged between Insys and Madison through cash and gifts to maintain him as one of their Subsys power prescribers. But what actually is Subsys? It's an aerosolized fentanyl spray over 100 times more potent than morphine. The FDA had only officially approved the drug for treating late-stage terminal cancer patients with pain so severe that nothing else brings them any relief. That's right, Subsys is something you should only be taking if you're already in the process of dying a painful death. That's why it's killed over 900 people since 2012. That was the drug that Insys was pushing for more doctors to shill through off-label prescriptions. Because it's so addictive, even one new patient makes for long-term revenue of 6 figures for Insys. If the lap dance wasn't tacky enough for you, the criminal trial into the shady dealings of Insys revealed something even more craven. a rap music video that they'd created to persuade doctors to prescribe more Subsys. The video, called Great by Choice, features two Insys executives rapping about their deadly drug. Meanwhile, a third performer dances around dressed up as a giant bottle of Subsys. Interestingly, the 1600 micrograms bottle, the highest legal dose. Insys is definitely one of the loudest and most obnoxious with their doctor-corrupting tactics, but they're just doing what everyone else in the industry is doing. A 2019 ProPublica analysis even found that doctors do prescribe more drugs from certain pharma companies after being given consulting fees. Given those six-figure numbers, conducting conspiracies with doctors is clearly a profit-making move, even if it does result in doctors selling out their patients. But in an industry rife with secret corruption, there is more than one way to turn sickness into a gold mine. Number 12. While everyone else was suffering through the COVID-19 pandemic, Pfizer was having a bumper few years, making $37 billion on their vaccine in 2021. It's officially one of the most successful products in human history. 2022 was even more of a barnstormer. Not only was there increased proliferation of the vaccine, but it also added a boost from their COVID-19 pill Paxlovid. It had a 90% success rate in treating severe symptoms for otherwise vulnerable adults infected with the virus. It all sounds great on the surface, given that all of these were undeniably extremely helpful in getting the pandemic under control and likely saved millions of lives. But as with anything in the corporate world, there's always some fine print there that they're really hoping you just won't look at. When it comes to that fine print, almost nobody gets the worst part of the deal more than the impoverished populaces of developing nations. The organization Global Justice Now was quick to point out that Pfizer's vaccine was made with the help of BioNTech. The German firm had a nice little boost of 100 million euros in debt financing from the publicly owned European Investment Bank and a 375 million euro grant from the German government. It's the rationale behind an old and depressingly true joke about the pharmaceutical industry. We pay for all our drugs twice. First, when our tax money helps develop them through lucrative government contracts, and then again when we need to pay through the nose to get the medicine that our tax dollars help develop. And this is a financial minefield for even middle-class Americans, not to mention the poorest of the poor in the global south. A representative of Global Justice Now put it best when he said, "The development of mRNA vaccines should have revolutionized the global COVID response. But we've let Pfizer withhold this essential medical information from much of the world, all while ripping off public health systems with an eye-watering markup." AstraZeneca provided its vaccine for considerably cheaper, and Moderna, to its credit, said it wouldn't enforce patent protection on its own vaccine. That meant people in disadvantaged areas could produce a cheaper generic version to meet the needs of their patients. Pfizer didn't do anything like that, because why would it? Now, when there's so much money on the table for them to just vacuum up. It's pandemic profiteering in its most blatant form, agreeing to help save someone from a burning building, but only if they agree to turn out their pockets too. We saw some even more blatant takes on this throughout the COVID-19 crisis. There were incidents where big pharma companies explicitly kept the profits of prepaid vaccines that were later canceled. It's the kind of shamelessness that you only cultivate when you are rich and connected enough to know that you're not ever gonna face any meaningful consequences. The worst part of this particular profit before patient conspiracy is that it's not even the only time Pfizer's done this, and for an even more horrific and deadly disease than COVID-19. They pulled the exact same shady tricks with medications for people suffering from AIDS, like the drug Rescriptor. Back in 2003, Pfizer reneged on a deal that would have made the drug substantially more affordable for people in poorer countries being ravaged by HIV and AIDS. All because the profit margins just weren't there. But unlike the parties involved in our next true pharma conspiracy, at least you can say they weren't in bed with genocidal mass murderers. Number 11. The Tanabe Pharma Corporation is one of the most powerful pharmaceutical entities in Japan, tracing its earliest progenitors to 1678. That's right, it's almost a 350-year-old company. Due to its age, mergers, rebrands, and the fact that pharmaceutical companies seem to attract bad reputations, it has changed its name many times. Until 2025, it was the Mitsubishi Tanabe Pharma Corporation. Before that, it went under many different guises, including the Mitsubishi Tokyo Pharmaceuticals and Wellfied Corporation, which merged in 2001. The real object of interest here is the Wellfied Corporation. That company was a product of two other entities that merged in 1998, Yoshitomi Pharmaceutical Industries Limited and the Green Cross Corporation. Of course, the Green Cross Corporation wasn't without scandal. In the late 1980s, they caused around 3,000 people using their blood products to contract HIV through contamination. The technology was known to be unsafe, but it was put out to market anyway. Though, can you really expect anything different when one of your founders is one of the most brutal and sadistic war criminals in living memory? That's right, one of the founders was Masaji Kitano, the second commander of Unit 731, a chemical and biological warfare research division. Their crimes against the Chinese people are some of the most horrific ever recorded. They intentionally gave people frostbite to see how it ravaged their bodies. They used living people as test dummies for rifles and bayonets. They amputated and vivisected conscious patients. They intentionally infected people with syphilis and the plague. They forced pregnancy. People were starved, crushed, mangled, injected with animal blood. If we tried to list every awful thing they did at Unit 731, it would consume this entire video. And one of the top guys behind it all got away scot-free, consulted on American warfare programs, and then helped start Green Cross. We know for a fact there wasn't even just one member of the monstrous unit on the team. Ryoshi Naito was also intimately involved in Green Cross. Not only was he involved in the Unit 731 atrocities, but also he took part in the post-war government drive to cover up the worst of their shared crimes. And the scariest part is, it worked. Imagine it like this. It'd be like finding out that Heinrich Himmler and Eichmann both died of old age, and they were on the board of directors at Pfizer. And as you're about to learn, big pharma and unethical human experiments are anything but an anomaly. Number 10. We return again to Pfizer, who have a considerable rap sheet when it comes to extremely sinister pharmaceutical conspiracies. This one has a legally confirmed body count. In 1996, a horrific meningitis epidemic was tearing its way across Nigeria with almost 110,000 cases and nearly 11,700 deaths. The global community, both public and private, pooled their resources in order to meet the needs of the crisis. One of those entities was, of course, Pfizer, who noticed an opportunity to kill two birds with one stone. Sadly, they ended up killing far more than that. Pfizer decided that the meningitis outbreak was the perfect time for a new clinical trial for one of their drugs, Trovan. It had been cleared by the FDA to treat adults, but the tests had not been conducted on children in the West for, well, obvious reasons. Nigerian children with no other option seemed like they would be safer guinea pigs. Maybe some of them would even be cured in the process as well. A win-win, theoretically. But everything about the way Pfizer conducted these tests was extremely unethical and some would say outright evil. They didn't give the parents of the children who took Trovan informed consent. They never told them that the drugs being used on them were experimental. They even performed these experiments in hospitals where personnel from Doctors Without Borders were treating patients with proven and legitimate methods. 200 children were given Trovan, 11 died as a result. Many others dealt with debilitating side effects, speech and hearing impediments, blindness, liver failure, paralysis, and neurological disorders. Parents were told that they had hope of a cure, and instead, they had their children disabled in an American big pharma company's drug trial. This was seen by many Nigerians as a direct political attack against the country's majority Muslim population from the West. And if this horrifying incident wasn't bad enough on its own, it's left a lasting and extremely dangerous legacy of vaccine skepticism across multiple African countries. As of 2022, only 23% of people were vaccinated across the entire continent. Incidents like Pfizer's deadly trials have been huge driving forces in keeping these numbers lower than the herd immunity threshold. All Pfizer suffered for this was some bad press, as well as an alleged out-of-court settlement of $75 million to the local state and $175,000 to 4 families of dead children in 2009. That amounts to a rounding error on their yearly profit margins. Medicine is expensive, but it's necessary. But what if one of the biggest reasons that medicine is so expensive was actually it's just a big lie? Number 9. If you wanted to find a living symbol for everything that the general public despises about Big Pharma, you could not do much better than the infamous so-called Pharma Bro, Martin Shkreli. He made headlines in 2015 after acquiring the life-saving toxoplasmosis drug Daraprim with his company Touring Pharmaceuticals. He then jacked up the price from $13.50 per tablet to $750. It was one of the most shameless acts of corporate greed, even by an industry that is full of them. To rebuke Shkreli, a bunch of teenage boys in Australia made the active ingredient in the drug for a fraction of the price. Their classroom experiment produced 0.13 ounces of pyrimethamine for $20. In the US, that same quantity would cost up to $110,000. But that didn't dissuade Shkreli from continuing to represent all of his chosen industry's worst instincts. The higher costs that he was employing were necessary for innovation, he said, owing to the high costs of research and development, or R&D. That was a lie, because that's what's at the heart of this conspiracy. Pharma companies absolutely love exaggerating the costs of R&D. It gives them an opportunity to increase the price of their drugs on the other end. Not only is R&D much lower than they say it is, they generally spend about a third as much on R&D for each drug as they do for that same drug's marketing. According to the report, R&D Myths, the case against the drug industry's R&D scare card by pro-consumer watchdog nonprofit Public Citizen, Big Pharma actually only spends a fifth of what it claims to spend on drug R&D. A lot of this cost is actually also funded by the taxpayer. In 1995, U.S. taxpayer-funded scientists conducted at least 55% of the research projects that led to the discovery and development of the 5 top-selling drugs, as per data from the National Institute of Health. Big Pharma likes to say that it takes $2.6 billion to take a drug from the laboratory to the market, which is an insane exaggeration. It's based on an extremely flawed study by the Tufts Center for the Study of Drug Development, which has been anything but transparent about its sample size and research methods. Independent research has shown that median costs for one successful clinical trial phase are probably closer to around $19 million. It's barely a fraction of the total capitalized pipeline number that Big Pharma loves to tout and is just hoping that you will not look too closely at. Lying about your own costs to artificially inflate your prices and your profits is an absolutely reprehensible tactic. But when it gets really dangerous is when Big Pharma lies to persuade you into taking a drug that you really shouldn't be taking. Number 8. Everyone knows drugs have side effects, with the more severe ailments typically adding up to more severe potential after effects of treatment. Anyone on medication is taking an informed risk, choosing whether they would rather suffer the symptoms of their illness or face the potential risk of relieving those symptoms, at least when pharma companies are actually being honest about those risks. That's exactly what happened with Merck and Vioxx, an anti-inflammation drug. According to the Union of Concerned Scientists, quote, Merck used flawed methodologies biased toward predetermined results to exaggerate the drug's positive effects. Not exactly the kind of secret tactics you want to see when real human lives are on the line. Merck violated a major tenet of how these drug trials are supposed to work. After testing the effectiveness of Vioxx against the effectiveness of naproxen, a competing drug, executives falsely claimed naproxen possessed a unique cardioprotective effect. What kind of data were they trying to hide with this kind of corporate sleight of hand? Well, it could be the fact that Vioxx was proven to increase the risk of heart attacks in patients by around 400%. And then there's the anti-arthritis drug Celebrex from our friends over at Pfizer. It probably felt like a godsend to the people receiving it, and for a time it was actually one of the company's most profitable drugs. That was until 2012 revealed that Pfizer was cherry-picking test data to make the drug seem a lot safer than it actually was. While there were Celebrex-related deaths from both stomach ulcers and heart attacks as early as 1999, these were falsely portrayed as freak outliers not worthy of much attention. Execs were shown colluding over email to ensure that the data was manipulated into the best possible light. They needed to shell out more than $164 million to settle an investor class action lawsuit in the aftermath. They were also forced by the FDA to stop promoting Celebrex in all of its forms to the public, even though it was technically still allowed to stay on the market. You might not even be surprised to hear that these huge companies bend and stretch the truth for money, and they leave human lives as their collateral damage. What might surprise you, though, is one of the secret conspiratorial techniques for how exactly they pull it off. Number 7. When was the last time you heard about a major medical breakthrough on the news? Some paradigm-shifting drug or treatment that seemed to march the science of medicine forward in a bold new direction. If you can't remember one since COVID, you're not alone. Part of the reason for this is that a lot of big pharma companies think it's a better decision to invest in Me Too drugs instead. Also known as follow-on drugs, these are drugs that are extremely similar to pre-existing medications with some minor modifications. There are benefits to Me Too drugs, from making minor but necessary improvements to the original drug to providing a wider range of options for patients with highly individuated needs. But while that is definitely not nothing, critics have accused Me Too drugs of effectively being a big, hungry leech attached to the side of the pharmaceutical industry. Some of the main criticisms of Me Too drugs is that they're siphoning research and development for drugs that just expand Big Pharma's product lines. The numbers are pretty concerning. They show just how much of total drug production is devoted to Me Too drugs rather than innovative medicine. More than 60% of medicines listed on the World Health Organization's essential list are Me Too drugs. This is especially concerning for antibiotic researchers, where the threat of antibiotic-resistant infections always looms. Constant evolution is required for staying ahead of the threat. But this isn't even close to the most diabolical trick that Big Pharma likes to employ when ensuring their drugs can make maximum profit. Number 6. Patents. They're the reason why Pfizer could gouge their vaccines, and Martin Shkreli could deliver that insane price hike with Daraprim. The problem, at least from the Big Pharma perspective, is that patents aren't eternal. On average, they only last about 14 years. Some studies have shown that the kind of generic versions available for out-of-patent drugs can be as much as 95% cheaper. So, if Big Pharma wants to keep their prices as high as possible, they need to find a way to artificially extend their patents beyond their natural lifespan. This devious technique is called evergreening. You'll never look at Big Pharma the same way again after finding out about it. It is deceptively simple. The companies keep seeking new patents on shockingly minor variations of the original drug. Say they add a new ingredient, like the Me Too drugs we were discussing before. Or they roll it out in a new dosage or a new method of taking it, say like from an injection to an inhalant or a pill. Internally, Big Pharma likes to call this life cycle management, when a more honest nickname would be price management. Even if the patents are contested, the companies don't mind. After all, while they're throwing away money on legal battles, they're still able to sell their drugs at an on-patent price. Their accounting department has probably already done the cost-benefit analysis. Those legal fees are a drop in the bucket compared to what they're making while those battles are still playing out. Dr. Joel Lechtchen, a professor in the School of Health Policy and Management at York University in Toronto, has said, "Typically, when you evergreen something, you're not looking at any significant therapeutic advantage. You are looking at a company's economic advantage." Evergreening is an open secret. The exact kind of lawful but awful technique that hurts the poor and the sick but delights the company's shareholders. But what about the times when science works against Big Pharma's interest and they try to brush it under the rug? Number 5. Can you even call it a conspiracy if you don't have sinister corporate forces threatening a whistleblower into silence? That's exactly what happened to Dr. John Buse when he discovered that Avandia, a diabetes drug owned by GlaxoSmithKline, was causing heart disease in patients during clinical trials. The year was 1999, and Dr. Buse was working at the University of North Carolina when he made his discovery and published his findings. This triggered an almost immediate threat of legal action from GlaxoSmithKline that would have destroyed Dr. Buse's career and ruined him financially. There would be no way that a man on a researcher's salary could ever go legally toe-to-toe with a pharmaceutical giant. The threats were so great that Buse was forced to sign a letter created by the company that discredited his findings. It said that the data was taken out of context and that further study would be needed to prove anything conclusive. But here's the thing, further study bore out exactly what Buse was saying. Avandia really was incredibly dangerous. And as a result of all this, the FDA demanded a recall of all Avandia. In 2010, GlaxoSmithKline knew their drug was destroying people's hearts, but it was a moneymaker, so they sat on that information for 11 years. Who knows how many lives they destroyed while soaking up millions, if not billions, in profit. Cover-ups like this are the stuff of nightmares, but we can think of a product that hit real shelves that is somehow even more terrifying than all that. Number 4. Here are two words that really shouldn't be anywhere near each other: baby powder and asbestos. But highly diversified American pharmaceutical giant Johnson & Johnson put those two together. And then they hid the fact that they knew about it and that it was killing people for decades. Reports of mesothelioma, a rare and incredibly aggressive form of cancer, started popping up in women who had no workplace exposure to asbestos. So people began to wonder what the commonality was here. Few would have expected that the culprit was the talc contaminated with asbestos, except Johnson & Johnson themselves. In at least 3 tests by 3 different labs from 1972 to 1975, they had found asbestos in its talc and just decided to hide the results. The human toll of this is genuinely sickening. Over 11,000 people claim that Johnson & Johnson talcum powder is behind their cancer. This includes thousands of women specifically suffering from aggressive ovarian cancer. Some of these people were likely first contaminated when they were literal babies, all thanks to Big Pharma greed. For once the legal system at least partially vindicated the victims of Big Pharma, Johnson & Johnson were ordered to pay $40 million to the people who had gotten cancer from their infected talc. To top that, You would need something truly evil. Like proof that an active pharmaceutical company was a part of the worst crimes of the Nazis. Well, we got some news for you. Number 3. Much like Japan's Green Cross Corporation, Bayer, the creator of aspirin and many other well-known drugs, is a very old company. 162 years to be precise. Like Japan's Green Cross Corporation, some of Bayer's strides forward in the field of medicine have been assisted by forming alliances with some of the worst war criminals of World War II. This isn't just a case of a large company simply being tacitly complicit in the Nazi regime as a result of operating in Germany at the time. Bayer, as part of the IG Farben conglomerate, actively participated in some of the worst atrocities the Nazis ever committed, all just to enrich themselves. They paid a retainer to the SS doctor Helmuth Vetter to test drugs like Rutenol on prisoners at Auschwitz, Dachau, and Gusen concentration camps. Vetter was a man so despicable that he'd later be tried and hanged for his crimes by the Americans after the war. He also had help from Eduard Wirths and Friedrich Ontres, who tested Bayer drugs on women purposefully infected by tuberculosis and diphtheria at Birkenau Cell Block 20. Reducing these innocent people to human guinea pigs was just par for the course. Their larger-scale involvement as part of IG Farben saw them overseeing Jewish slave labor at Nazi factories. Of particular interest to Bayer was the chemical factory at Auschwitz. It was personally supervised by a senior Bayer executive and likely produced chemicals for Bayer's pharmaceutical work. In 1995, the then CEO of Bayer, Helge Wiemeyer, offered a public apology for his company's role in perpetrating human experiments and slave labor during the Holocaust. This video has proven that a lot of pharmaceutical companies have deeply sinister pasts, but they like to insist they've cleaned up their act and evicted the skeletons from their closets. These days, if they do anything bad, it's just an accident, right? Well, unless… Number 2. One of the most dangerous pharmaceutical companies to ever exist was the infamous Purdue Pharma, owned and run by the Sackler family. As the architects of the American opioid epidemic, they are likely responsible for more collective deaths than every serial killer in the last 200 years combined. And that's all thanks to one drug, OxyContin. It was marketed as a less addictive alternative to other painkillers on the market. But Purdue knew that wasn't true. They were aware that it was being crushed up and snorted as a powerful and dangerous recreational narcotic. They didn't care. There was money to be made. It didn't matter how many bodies needed to be stacked in order to make it. The New York Times uncovered a Justice Department document that proved beyond a shadow of a doubt that Purdue knew about recreational users of Oxy as early as 1996. Purdue Pharma's general counsel, Howard R. Udell, wrote in early 1999 to another company official, quote, "We have, in fact, picked up references to abuse of our opioid products on the internet. In public, they said the absolute opposite while aggressively marketing the pills." In 2007, Purdue pleaded guilty to misbranding the drug. But by that time, the genie was already well out of the bottle. Hundreds of thousands had died as a result of the opioid epidemic. It's hard to not trace it back to this one awful, cruel, greedy conspiracy. As bad as that sounds, there is still one utterly damning smoking gun. Number 1. Despite reasonably ethical concerns, it increasingly seems that biotech and gene therapy might just be the future of medicine for a huge number of diseases. It's the stuff of science fiction, but if enough R&D money was funneled into it, it might someday be possible. Humans may be completely cured of disease and illness rather than being treated symptomatically. That has attracted the attention of some big names. When thinking about investing in these companies, Goldman Sachs asked, "Is curing patients a sustainable business model?" That is an actual quote from a Goldman Sachs biotech research report. It's part of a longer quote from analyst Salveen Richter, who said, quote, "Such treatments offer a very different outlook with regard to recurring revenue versus chronic therapies. While this carries tremendous value for patients and society, it could represent a challenge for medicine developers looking for sustained cash flow." To cut through all that business jargon, what Richter is basically saying is, why let people buy their health when you could force them to rent it? It's the same sleazy business tactics as streaming service subscriptions and live service video games, except rather than playing with your entertainment and disposable income, it's playing with your life. And if this is what they're willing to say out loud, can you even imagine what else they're hiding? Say, you want some more chemical horrors? You should check out What Does Fentanyl Do to Your Body? Or watch this instead.